So Colorado's current COVID wave is not reflected across America. We are one of the 5 hardest hit states right now. And Colorado's public health leaders say they don't really know why. That would appear to be concerning. Here's Steve Staker.
Our volumes are up, obviously. When you look at the patients that have COVID that are hospitalized, they're primarily unvaccinated.
That's the frustrating thing for doctors and medical workers. Most of the growing number of the hospitalized with COVID in Colorado haven't gotten the shot. But it still doesn't explain why Colorado's seeing a surge while other states aren't.
Certainly there's a regionality. There's no question about that. If you look at our rates and compare them to Texas and Florida a month ago, we were really far apart. And now if you look at them right now, we are much higher than them.
As our numbers here started to rise again while so many other states waned, we've consistently asked the state's public health leaders if they can explain why. And they've told us they don't exactly know.
It's not just one thing that's probably driving this. And I think they are hoping to find a smoking gun, and it's probably not that simple.
Infectious disease expert Dr. Barron with UCHealth says we shouldn't be surprised that state health leaders can't pinpoint a precise reason why. Remember, this is a novel or new virus, even 20 months down the line.
These things take years and years and years, and we still will probably not know everything even after that. HIV is a great example. Like, how long has HIV been around? 20, 30, 40 years, maybe longer now, if I do the math. And we still don't have all the answers to that. And that's a common virus that we've seen.
Dr. Barron says there could be a level of seasonality to the virus, too. Think about last November when things got bad. But she says that the data also disputes that because we've seen spikes in warm and cold weather. Shows that it likes the cold, but it also seems to like the warm. It could take years of study to try to figure out how this virus works and what leads to wider spread, Kyle. But the thing you have to remember is we've done a lot of things with this virus very quickly. We've kind of operated at warp speed, and I think that that's how our brains trigger now, is that we think that we should know everything about this because things have moved so quickly.
Yeah, we forget the novelty of the novel coronavirus, that, you know, just because somebody is a medical professional or they're a research scientist, they can't just flip to that page in the book and say, well, here's what we've learned over the last 50 years.
Absolutely. And I think we've gotten kind of a gift here. We have a vaccine already. A lot of different developments that we've been able to figure out how the disease spreads a little bit easier. But it's going to take years and years of study. In fact, they'll probably be talking about this in college classrooms and universities for a long time.
It's disconcerting when we don't have the answers about why the virus is doing what it's doing. And then what happens is a lot of times people's political beliefs about what's working or what's not working gets supplanted for the best available science, even if it isn't complete. All right. Thank you, Steve.